There's the noon siren.
Our next door neighbor's dog loses its damn mind every Wednesday. Meanwhile, ours is just like, meh. Like,
yeah.
I'm not interrupting my nap for any siren.
Yeah.
I think it startles me more than our dogs. They're still asleep behind me.
I feel so bad. He's like a white German Shepherd, and he just has this howl that just sounds like, you know, basically there's torture happening next door. I'm like, it'll be over in a minute, buddy.
Hang in there. Yeah. All right, I see that I am the host now. So if any of our participants are in the process of logging on or have already logged on and are waiting, we're just going to give it a few moments to get everybody online and then we'll get started. All right, Allie, are we connected on Facebook? This is preparing. All right, just in case anybody just joined and wondered why we're all staring at our screens in silence, we're just giving it a second. We want to get this up on the Facebook stream so that folks who didn't get the login can still catch the webinar. So we're giving it one more minute and then we'll get started. All right, I'm not sure if we are on Facebook yet, but we do have 8 attendees, and for sake of time, I want to try to keep on schedule as much as possible. So I'll just go ahead and get started with the introduction, and then we are recording, so worst comes to worst, we will just post the recording on Facebook. Hi, everyone that's joined us. My name is Sarah Ingles. I am the board president of the Central Ohio Worker Center, which is a 501c3 organization here in Central Ohio with a mission to educate and empower low-wage and immigrant workers in the Central Ohio area regarding their rights in the workplace and largely their power in our communities. The Central Ohio Worker Center promotes a culture of solidarity, one which brings all working people and immigrants together in the fight for economic and social justice for all. Thanks for joining us today. Today, you're joining us as part of a series of webinars based on a video project that we were awarded a grant for from the City of Columbus, the Department of Public Health, and then a separate grant from Columbus City Council. And with part of that money, we used it to put together informational videos about workers' rights and the COVID pandemic and things that workers in our community are currently facing so that we can get that information out in a more digestible format. Those videos will be translated and subtitles will be used in multiple languages. We're going to start out with Spanish and Somali and work our way out from there. And then obviously the videos themselves are in English. And as part of the project as well, we're going to have these webinars. So yesterday we did a webinar talking about unemployment compensation and the federal legislation, where it stands. A lot of it has kind of fallen back because it was not included in this last federal stimulus bill. So we talked a little bit about that. If you're interested in seeing that webinar, it is on our Facebook page. So you can go to the Central Ohio Worker Center's Facebook page and the video will be right there for you to view. In addition, we're able to send it. So just email us if you're having trouble getting access to not only the produced video, but also our webinar, because there's a lot of really good information about where the law currently stands. But of course, as new legislation comes out, it gets outdated. So you constantly wanna, check in and ask the questions that you need to be asking to make sure that you're getting the right advice and that you really understand what the current state of the law is, which right now is very difficult, hence why we're doing these projects. So this is our first video that we did in our second panel that will be discussing wage theft, explaining wage theft and how workers can get what they're owed under the law, and protections for raising workplace issues. It's a discussion of the NLRA and the NLRB, and then we're going to fold in some of this COVID dynamic so that we can talk about how that's affecting people in our communities and what workers can do to assert their rights and make sure that they're safe on the job. So we're going to go ahead and get started, and we're going to watch a short video. It's about 15 minutes, so hang in there with us. It's a pretty good but pretty dense video. So if you're not catching everything or you want to see it again, this is all recorded. You will be able to see this later on if you want to go back to something, and then we're going to discuss it at the end of the panel. So hang in with us, and I will go ahead and share my screen to get this rolling. All right. Sorry about that. I heard that you do not have audio. So let me try this again. Here we go. Okay, stop sharing. Let me try this again. Again, technical difficulties. Sorry about that. We'll get there. I cannot get this thing to go away. Okay, let's try this again. Maybe this time I'll do it correctly. There we go.
In 1968, a year of protest and upheaval, not unlike our own times, Dr. Martin Luther King Jr. said, "Whenever you are engaged in work that serves humanity and is for the building of humanity, it has dignity and it has worth." Dr. King spoke those words in Memphis, Tennessee, where he had traveled to support striking sanitation workers and their campaign for good pay and benefits and respect on the job.
Hi, I'm Nana Watson, president of your Columbus NAACP. Dr. King said with Selma and the Voting Rights Bill, one era of our struggle came to a close and a new era came into being. Now our struggle is for genuine equality, which means economic equality. We still have some work to do when it comes to protecting voter rights. But in the Central Ohio Workers Center video, we focus on some of the ways we can work toward economic equality. Civil rights and economic rights have always gone hand in hand, and that's especially true during this pandemic that has hit Black and low-income communities so hard. Let's talk about what we can do about it.
The idea that every job has dignity, that we all deserve a paycheck that allows us to live a good life, the right to be treated with respect by our supervisors, managers, and the owners of the businesses that depend on us, these are values shared by all working people. And they are the values that unite us during a global pandemic that threatens our health, our paychecks, and our communities.
The Central Ohio Workers Center, or COWC for short, is committed to organizing and advocating on behalf of low-income and immigrant workers in our communities. As NAACP President Nana Watson said, this COWC video focuses on economic equality, and in particular, the barriers to achieving it, the laws that can help us secure it, and what you can do in your workplace and neighborhood to win it. We hope that you find this information useful, and we invite you to join us in the effort to win economic justice for all working people in our communities.
You're supposed to get paid for all the hours you work. Your employer is required to pay you at least the minimum wage, and you get paid overtime when you work more than 40 hours in a work week. It's simple, right? It is simple because it's fair and it's the law. But unfortunately, too many working people are not paid all the wages they earn. When an employer refuses to pay an employee all their wages, it's called wage theft. You may not have heard the term wage theft before, but there is a good chance that you know someone who has experienced it. In fact, you may have experienced it yourself. Forms of wage theft include not receiving at least the minimum wage, taking employees' tips or failing to pay tipped workers the difference between the minimum wage and their tips, not receiving overtime pay for hours worked in excess of 40 hours during a work week, receiving only partial pay, illegal paycheck deductions, being forced to work off the clock, being misclassified as an independent contractor to avoid minimum wage, overtime, and other laws, or simply not being paid at all.
Wage theft occurs every day. It's happening to someone right now while you're watching this video. How big of a problem is wage theft? The current minimum wage in Ohio is $8.70 per hour for non-tipped employees and $4.35 for tipped employees. It's estimated that more than $600 million a year is stolen from Ohio workers in minimum wage violations alone. Wage theft also deprives Celebrate One and other communities of tax revenues for infrastructure, public investment, and social services.
If you're an hourly employee required to do extra work, like setting up before clocking in or cleaning up your work areas after your workday is over, you have the right to be paid for that time, even if your employer tells you that it's off the clock. If your employer refuses to pay, it may be wage theft. If your employer refuses to pay you at least the minimum wage, it's wage theft. If you work more than 40 hours in a work week, eligible employees must be paid time and a half for hours over 40. If your employer refuses to pay it, you may be the victim of wage theft. Workers are often told that they aren't eligible for overtime because they are independent contractors, when in fact, they legally should be classified as an employee.
And if you quit or you're fired from your job, you have a right to be paid for the hours worked.
Who are the victims of wage theft? Studies indicate that Black, brown, other people of color, young workers, women, and immigrants are more likely to experience wage theft because they are more likely to be in low-income jobs. The majority of workers who experience wage theft are over 25 and native-born United States citizens. Nearly half are white, more than a quarter have children, and more than half work full-time. Law-abiding businesses are also put at a disadvantage. In other words, wage theft affects all of us, and it is a barrier to economic equality. Therefore, all of us must work together to end wage theft. What can we do to fight back against wage theft in our communities?
Hi, I'm Rob Dorans, member of Columbus City Council. Government needs to do everything it can to prevent wage theft. And most importantly, victims of wage theft need to raise their voices and organize to protect their own rights, their coworkers, and their communities. The Fair Labor Standards Act is a federal law that requires employers to pay no less than the minimum wage and overtime when eligible employees work more than 40 hours. In Ohio, we have a state wage and hour law with similar requirements. Wage theft is against the law, and it's illegal to retaliate against workers who report wage theft. The City of Columbus recently passed a strong new anti-wage theft law. It prevents businesses found guilty of committing wage theft from receiving city contracts and city financial incentives. The city will also refer victims of wage theft to federal and state authorities so they can obtain no-cost assistance to receive the money that they're owed.
COVID-19 has had a terrible impact on our communities. Folks have gotten sick, lost jobs, had their hours cut, and died because of the virus. We can feel cut off from our coworkers, friends, and families, but we're not powerless. And when we work together, we become stronger as individuals and as a community. There are laws that protect us when we demand that employers follow health and safety laws, and when we organize for better pay, benefits, and working conditions, including protections against COVID.
COVID-19 is a deadly and highly contagious virus. If people with serious medical issues or older people become infected, they are at a higher risk for serious complications and even death. In fact, anyone who becomes infected can become very sick, experience serious complications, and die from COVID-19. We may become infected by the virus and not know it, but we still can infect others even if we don't have any symptoms ourselves. As the number of hospitalized COVID-19 patients increases, our co-workers, neighbors, friends, and family members who need medical care for other reasons are placed at risk because their treatment may be delayed due to a shortage of hospital beds, staff, and other resources. COVID threatens our health, our jobs, and our neighborhoods. So, what can we do to protect ourselves and other people in our community?
Knowledge is power. It's important that all of us know our rights and how to enforce them. Under the Federal Occupational Safety and Health Act of 1970, a covered employer must keep the workplace free of known health and safety hazards. As an employee, you have the right to speak up about health and safety hazards without fear of retaliation, and you can file complaints with the Occupational Safety and Health Administration, which is known as OSHA, to enforce your rights. If possible, you should tell your employer about your concerns. If you believe your working conditions are unsafe, you may file a confidential complaint with OSHA. You ask OSHA to conduct a workplace inspection. You can call the Columbus OSHA office for answers to your questions and for assistance with filing a health or safety-related complaint or a whistleblower complaint if your employer retaliates against you. Your employer is prohibited from discriminating against you. That means firing you, disciplining you, cutting your pay, denying you a promotion, or retaliating against you in any way because you filed a safety or health complaint with OSHA, raised a health and safety concern with your employer, participated in an OSHA inspection, or reported a work-related injury or illness. consult OSHA about the strict timelines that apply to complaints. The Ohio Department of Health has issued mandatory COVID-19 guidelines that all reopened workplaces in our state must follow. If your workplace is not in compliance, you can take action to protect yourself, your coworkers, your friends, family members, and your community, and hold your employer accountable.
You can review the mandatory requirements for your job by visiting www.coronavirus.ohio.gov. Click on Responsible Restart Ohio, and then click on sector-specific operating requirements. If you don't see your industry or occupation, click on Primary Sector and locate guidelines there. For most jobs, the Ohio Department of Health requires masks and social distancing or barriers between employees when they are indoors, with limited exceptions. Check your job sector on the Ohio Department of Health's website to confirm the requirements for your workplace.
If your employer is located in Franklin County, Ohio, and not following Ohio's mask, social distancing, and other COVID-19 safety requirements, you and your coworkers have the right to file a complaint with the Franklin County Department of Health. You can file the complaint online by visiting www.myfcph.org. Click on Coronavirus Disease 2019, and then click on COVID-19 complaint form. You can file complaints anonymously or by using your own name. In addition to checking boxes that apply to your complaint, such as mask, social distancing, or hand sanitizer violations, the complaint form includes a comment box so you can provide more information. In most cases, a violation of Ohio's COVID-19 requirements will impact not just you, but also your coworkers. If that is the case, include information about how coworkers are impacted in the comments section. If you need assistance with filing a complaint, call the Franklin County Department of Health or contact the Central Ohio Worker Center at centralohioworkercenter@gmail.com.
One of the most important workplace laws is the National Labor Relations Act, or the NLRA. Signed into law by President Franklin Roosevelt in 1936 during the Great Depression, after massive protests and strikes spanning nearly a century, the law recognizes the right of employees to form, join, or assist labor unions and to bring complaints and concerns about pay, benefits, health and safety issues, and other working conditions directly to their employer without fear of retaliation, discrimination, discipline, or discharge.
The NLRA protects collective action in the workplace. Your right to stand up for yourself and your coworkers, and their right to do the same for themselves and for you. The law basically protects your right to have your coworkers back on the job and vice versa. Examples of protected activity include talking with coworkers about the need for better working conditions, such as COVID-19 safety protections, circulating a petition demanding better pay, benefits, schedules, and effective health and safety protections, and joining with coworkers to talk directly to your employer about the need for improvements at work. The NLRA also protects your right to form a labor union, so you and your coworkers can use your collective strength to negotiate with your employer for better pay, benefits, and working conditions during the pandemic and beyond. Once a union has been certified or recognized, your employer is required to bargain over your terms and conditions of employment with your union, including pay and essential safety protections during the pandemic.
For more information about your rights under the NLRA, you can visit the NLRB's website at nlrb.gov or call 513-684-3686.
Studies prove that union members earn higher wages and receive better benefits and working conditions. Hourly wages for Black union workers are 14.7% higher than those of their non-union counterparts. Joining a union helps Black workers close the racial wealth gap in the United States. For Black workers, the increase in earnings, benefits and employment stability from union representation translates to a higher likelihood of home ownership and larger contributions to 401k retirement plans.
Stopping wage theft, making sure we are safe at work, and using our collective voices and powers to reduce the racial wealth gap and achieve fairness on the job. This is what it would take to win racial and economic justice in our communities during the pandemic and beyond. We need to know our rights and enforce our rights and organize for social justice.
The Central Ohio Workers Center has made additional materials and resources available on its website at centralohioworkerscenter.org. Most importantly, we want to work with you on the workplace and community issues that matter to you. Please join COWC today or register for updates so we can stay in touch.
All right. Well, I love that video. I always have so much fun watching it, and I'm so excited to debut it. Hope that everyone had a chance to at least kind of pick up some of that. Again, I know it's a lot of information to throw at you all, but you know, I think that it's something that we can go back to, and certainly our panelists today are going to address many of the issues and topics that were touched on in that video. So I'm going to go ahead and get started by introducing our panelists. Today we have three very awesome people with us who are going to drop some knowledge on us and talk about some of the things that we heard and put it into some real life context. Our first panelist is Rob Dorans. He's a member of Columbus City Council and the chair of the Technology, Public Utilities, and Neighborhoods Committee. Rob's work focuses on pushing the city to adopt a $15 an hour minimum wage for its workforce. And he sponsored the creation of the Wage Enforcement Commission to combat wage theft in the city of Columbus, among other achievements. When Rob is not in his city council role, he serves as the chief legal counsel for ACT Ohio, a labor-supported nonprofit that advocates for best practices in the construction industry in Ohio. In his role as chief legal counsel, Rob has helped enact numerous responsible contractor policies across Ohio and has led prevailing wage investigations that have resulted in the return of hundreds of thousands of dollars in back pay to defrauded workers, supporting union organizing drives, preparing charges before the NLRB, and he's provided legal services in over 130 local building trade unions and regional councils in Ohio. So we're very excited to have Rob here today with us. In addition, we have Dominic Mendiola, who's a labor representative with the Ohio Nurses Association, where he has been working since 2018. Interestingly enough, Dominic's first job was as a farm laborer, which inspired him to pursue his career in organizing. Dominic began his organizing career working to repeal Senate Bill 5 through Working America, a group affiliate of the AFL-CIO. And after that successful campaign, he began organizing nursing homes and mental health facilities throughout Ohio and West Virginia with the Service Employees International Union. He later led the Fight for 15 campaign in Cleveland, and his team organized 1,500 home care workers through grassroots movement building. He went on to continue coalition building and political organizing with the For Our Future Fund, a labor-backed super PAC focused on empowering communities of color. And then in addition, we have Jennie McAdams, who's a sustainability supervisor at the Franklin County Public Health. Jennie has served in this role for almost a year and a half, but before that has a very long history with Franklin County Public Health. She has served as the Health Promotion and Community Engagement Supervisor and as an Accreditation, Workforce Development, and Performance Improvement Coordinator at the Franklin County Public Health. So she's a wealth of knowledge, and she's currently serving as the liaison officer for COVID-19 response here in Franklin County. So we're very excited to have her. She's going to be sharing a lot with us, and all good, all relevant things. So without further ado, I'm just going to go ahead and get started. And I'm going to start with wage theft because that's kind of where the video started with us. And I'll start with Councilman Dorans. you led the effort for the recently enacted wage theft prevention ordinance in Columbus. Can you talk with all of us on this webinar about the impact of wage theft during the pandemic in terms of how it affects employees and the employers that follow wage and hour laws?
Yeah, well, first, Sarah, I want to thank you and the Worker Center for the hosting this event today. Also for putting together that video. I think that's such a perfect way to really translate what sometimes can be sort of legal jargon into a very accessible way for people in our community to think about how their rights are accessible and how they should protect themselves, whether we're in a pandemic or not. So appreciate the work that you've done, and certainly the Worker Center has done to lift up these important issues in our community. I also have to say I've got my 2-week-old strapped to my chest here, so if he starts screaming at any second, I will try to make sure that he agrees with me one way or the other, depending on what we're talking about. So, you know, I think when we talk about wage theft, I think the video did a good job of sort of setting the table for this part of the discussion. Is that, you know, when we talk about wage theft, it more often impacts, you know, people of color, women at the lower end of the economic earning spectrum. And, you know, there's a few different industries that we see this come up quite a bit in, right? We see this in, you know, the service industry, and, you know, janitorial work, and in food service, sometimes in construction. You know, these are industries that have been hit really hard in the pandemic. When you think about some of the businesses that, you know, have not been able to function as normal in a pandemic like this. So we've seen businesses that already have, you know, very thin margins to begin with, have even more difficulty being able to make a profit. And unfortunately, there are businesses that say, hey, I'm in a tough position here. How can I make that up? Well, you know, unfortunately, there are some that look at their workers as a way for them to make up lost profits. So, you know, I think that when we talk about what has happened during the pandemic, wage theft was an issue in our community across almost every industry. But again, in a few that I've mentioned were very significant. It's become even tougher in a pandemic. And also at the same time, it's become tougher for folks to stand up for themselves. And there we have it on cue. So, you know, I think it's, you know, an accessibility issue, but also an issue for workers, and depending on how long the pandemic has went.
Yeah, so I think that's a great overview, and it certainly is a huge problem always, but it's accelerated in a pandemic, right? Because you're dealing with that issue and everything else that everyone else is dealing with. So we talked about the new ordinance that went into effect recently. So what are some of the key components of that Columbus wage theft ordinance? What should people understand about it?
Well, I think one of the biggest things to know is the independent contractor language that's in the ordinance. So, you know, as the video points out, you know, unfortunately, we have too many times workers will be categorized as 1099 or independent contractors. And that means a variety of things for them. That means their payroll taxes aren't being collected. That means when come tax time, they're going to have a big tax bill in front of them. And also workplace protections that most folks enjoy, it's going to be a little bit more difficult for those workplace protections to apply. And we know that the vast majority of people do not legally qualify as an independent contractor. They should be W-2 employees. So one of the things we've done with the ordinance is on city contracts and development sites, anything that has a city incentive, you know, employers are not going to have to justify the usage of folks as independent contractors. And I think that's really, really important to have a presumption that people should be W-2 employees. Because again, the facts show us that the vast majority of people do qualify as W-2 employees with all the protections that brings. So, you know, if someone is working in our community and they're being called a 1099 worker or independent contractor, this ordinance gives us a mechanism for forcing that employer to justify their use. Because unfortunately, both at the state and the federal level, we have not seen the type of enforcement on this that we'd like to see. So while the ordinance itself, you know, doesn't create any new wage and hour law on its own, what it does do is create an enforcement mechanism here at the local level to make sure that, again, on this very critical issue, especially at a time like right now in the pandemic, where we might see businesses try and cut a few more corners, to make sure that there are key protections in place for workers.
Right, and those key protections, I guess, can you elaborate if somebody on this call or somebody who views this later on is an employee who believes that their wage, that they're being paid by their employer isn't proper, can they contact the city of Columbus for assistance? And is that employee protected against retaliation from their employer?
Great question, Sarah. So we are in the early stages of setting up the Wage Enforcement Commission. So right now, if folks have a concern about that, what I'd ask them to do is contact my office directly. One of the things that we did with the legislation was not only to, again, set up these enforcement mechanisms in place in order to assist workers, but also to have somewhere for them to call, somewhere for them to go to seek assistance. You know, picking up a phone and calling wage and hour at the state or federal level is not something that's the easiest thing for folks to do and really know where to go, right? You know, every level of government that you go up, the bureaucracy gets a little bit more difficult to access who can actually be of assistance to you. So one of the things we've really tried to do with this ordinance is to create that wage and hour body here locally that's a little bit more accessible, that will be out in the community. So, you know, the legislation requires us to have staffing, which we're in the early stages of getting that set up. It has had this commission set forth to make sure that they're able to accept complaints from people in the community. And then also at the same time, that commission then knows where that information should go. Is this something that should go to the U.S. Department of Labor? Is this something that should go to wage and hour at the state level? In order to assist folks with pointing them in the right direction and making sure that those things are adequately, you know, addressed. So we're very much in the early stages of the ordinance being stood up and the commission doing the work. But I'm very excited where we're headed, and I'm certainly hopeful that in a year from now, when we have this conversation again, we'll be able to say, here's the number to call, here's the email to call, all that kind of thing to make sure that folks know exactly where to go if they're experiencing this kind of issue. And I think the last thing I'll mention is that people are owed the money that they should have gotten, right? This is something that I think, President Watson from the NAACP mentioned in the video. I know the folks on this webinar, agree, but, people are owed the wages that they should have been paid in the first place. So, but all too often there are barriers in place for folks to be able to access resources, whether that's through an administrative body or the legal system, in order to be connected with folks to make sure that they're paid. So, people should not be retaliated against under the law when they file a complaint. People should not be retaliated, whether again it was against the law to begin with. But we know that these are issues, and we're trying to make sure that we put protections in place for folks to be able to stand up and say, "Hey, I've got a concern, and I would like it to be addressed." Because all too often, employers that are engaging in this kind of conduct, and certainly not every employer, but those that do, they thrive. They absolutely thrive on making sure people don't know their rights and don't have access to venues to enforce their rights, which is why, again, I think the work that the Worker Center here is doing is so critically important. And that's why I think that the commission that we're standing up at the local level is going to have a real impact on being able to be out in the community with the Worker Center and other entities who engage with people to make sure that they know what their rights are, but just as importantly, where they go to enforce those rights. People should not be expected to be a wage and hour attorney in order to make sure that their rights are upheld. That's an unfair expectation, especially when some employers are trying to make sure that they sow confusion and mistrust in that. So I'm very excited where we're at. And I think in the chat here, someone put up my contact information at the city. People are welcome to contact me if they've got a concern right now. The ordinance is effective. We're just sort of doing some of the logistics to stand all the enforcement mechanisms up. But I'm very excited about where we are as a city to crack down on this type of behavior.
All right, well, thank you for that. And thank you for all your work on getting the wage theft ordinance to where it is. I mean, this is awesome. This is only the second city in the state of Ohio that has a wage theft ordinance. So it's a really big deal that Columbus has this. And it's really important that people know how to use the law, because the law is only as effective as people are able to use it. So thank you for all of that information. And if anyone has questions for Councilmember Dorans, you can enter that on Facebook if you're watching live on Facebook or in the chat here, and we will get to those questions here toward the end. But for now, I want to shift over to Jennie. Jennie is our, Franklin County public health expert here, and we're really excited that you're here with us. Couple questions for you. What services, resources, and COVID-19 information is the Franklin County Department of Health making available to residents during the pandemic? We saw in the video that there was, a website and all that kind of stuff, but can you speak to that a little bit?
Of course, I'd be happy to. And thank you again for having us. Currently, in terms of what resources we have during our case investigations, and this is just so you know, should anybody have COVID, as we do our case investigation, we do connect those individuals or those families to resources such as food boxes, cleaning supplies, help with rent, and those types of costs. We know that during COVID, not everybody has that ability to take off the quarantine or get paid for it. And also, you can't leave your home typically to get food. So we do have access to those emergency food boxes and those emergency supplies that can be delivered to your home. We also are working with many of our partners to have a curated list on our website of resources available in the community. It is under the resource tab, which I can pull up here momentarily, but really it's just essentially an omnibus of all the wonderful resources Columbus and Franklin County has to offer, from help with rent, help with utilities, to I think we even have an entire page dedicated to crafts kids can do at home while they're homebound and while they can't go to school if they're on quarantine. So there's lots of resources in our community. It really is just a matter of connecting them as well and making sure that everybody is aware of those.
Great. Yeah, and I've gone to that website and I've seen that there is quite a lot there. So if you're somebody who is interested in that, or you come into needing that information, make sure that you do visit the website. But in addition, the video that we just watched talked about this Responsible Restart Ohio, which has rules that cover masks and social distancing and sanitary requirements in the workplace. Are there other COVID-19 rules or regulations or information that the Franklin County Department of Health is telling employees, or that employers, or the employees who work for those employers should know about?
There are, I think as many people know, a lot changes quickly during COVID and a lot is coming out. To date, there are 108 orders that have been issued through the governor. So a lot of what we do at our department level is parsing through those and getting that information out to every residents, employees, and employers for what affects them. If you've ever read one, and they are sometimes a little difficult to understand, I admit, they rescind parts of another, but keep another part. So it's a lot of backtracking and making sure that they're all concurrent. We do still have the mask order in place, as well as you said, the social distancing requirements. Quite a few places are, if you'll note, when you go into a store, they're limiting people that can go there, especially the 10-person limit on social gatherings. And that's another one that we really do try to help out with. We can't limit 10 people all walking into a store, but if we do see a bar or a restaurant with hundreds of people packed in, that's definitely a cause for concern. And what we do, we really do try to do education first. Sometimes, yes, there are those folks who genuinely are willfully going against the orders, and we know that. But sometimes this is new for everybody, and sometimes it really is just that education and that awareness of what is impacting and how this is concerning to the community. So we try to work with everybody first. And I did want to point out as well, we are Franklin County Public Health, and we serve our jurisdictions, 43 jurisdictions, cities, townships, and villages throughout the county. But there's also Columbus Public Health, who does serve the city of Columbus and Worthington. So depending on where an organization is or a business is, you may get one or the other. Typically, our processes are fairly similar, but there may be differences in timing as well as who's coming to address it. So if you do submit a complaint to one of us and it's in the other, we talk daily, frequently and daily. So those will continue to be shared between our jurisdictions. A lot of what we are seeing in terms of businesses' complaints are those people aren't wearing masks, or they're not respecting social distance. We have seen quite a few complaints of sanitary products not being available. So your hand sanitizers aren't available to staff. And we do work with the owners to ensure that there is a reasonable way for staff to maintain that cleanliness. We are working a lot with those employers who have, and I'm going to share my screen here for just a second. Something of concern a lot of people do see is my coworker came in COVID positive, or my coworker's spouse is COVID positive. What do I do? Who's quarantining and who's telling us? So we've created a one-pager for both employees and employers for what to do should somebody test positive, or should somebody be a contact of somebody who's test positive. And I'm just going to share that really quickly, and I'll make sure that everybody has access to this as well. But you can see we do have a tier and a method to determine what to do, who should be quarantined, who should just monitor for symptoms, or who should be isolated. And I know that there's a lot of kind of confusion sometimes with isolation and quarantine and a lot of moving parts, but we at the health department really are here to help you with that. So if anybody has a concern, they're more than welcome to reach out to us. And on our website now, we do have a new button for an employee or an employer to report that somebody in their place of business is COVID positive. There's a lot of information at once, I know, but we really are happy to work with you. I know everybody's situation is different. It depends on the type of business or who was there last, how many people were there. So we're working through a lot of that with everyone.
Great. Yeah, thank you for that. And you said that this is on the website. So if somebody wants to view this one pager,
Yes.
they can go to the website, they can actually download it, print it, email it
Yes,
to their employer, whatever they need to do.
I can pull that up. Actually, if you have just one moment, I can share my screen for that as well, just so you can see where it is on the website.
Great.
So you'll be able to see here, if you're a business, school, daycare, et cetera, you can report a case. Here are the advisories. And as they showed in the video, here is the complaint form, which will go directly to our team and we'll send out to investigate. But under resources, you will be able to see some of these shareable items and Restart Guidance Ohio. So all of our information is here for businesses and employers. There's a lot on the website. We're constantly updating it and tweaking it to make it a little easier to find. But I did just want everybody to know that it is there and we are happy to work with everyone. I think the other thing just to mention too, in terms of employee-employer relations, is that complaint form. If you put your name and address on there, it's not disclosed to who you reported against. It's more so that we can call you back if we have further questions or if the information was incomplete.
Good to know. Good to know. Because I know that that's a lot of people's concern is, I want to report it and I want this to get fixed, but I'm afraid of what's going to happen and I need my job right now, right? That's a very real situation for a lot of people. So that's really good information to know. I guess, yeah, go ahead.
Oh, I will say just, it is public record if somebody were to request all of it, as many things are, but it's not, we don't disclose it when we go out.
Not an initial or immediate.
It would be.
Yeah. So I guess going with this complaint situation. So if we saw on the website where you should go to file the complaint, it's we saw in the video, it's a fairly easy form, but what happens after that? What happens after the complaint is filed? And has the Franklin County Department of Health received many complaints? And what are the penalties for non-compliance? I mean, what happens?
So currently, we have had over 3,800 complaints this year alone. In our typical year, we're looking at like 1,000. So it's definitely seen an increase.
Yeah.
And what we do, our team parses those between medical complaints or medical questions, such as those COVID ones I discussed. And then they go into like the business ones where you're not wearing a mask, you're not social distancing. So once we get that notification, someone on our team will initially reach out to that organization to speak to somebody to try to get a feeling of what's going on ahead of time. Quite honestly, a lot of what we see are point in time complaints of perhaps a customer going in and saying another customer wasn't wearing a mask. We do a call to the manager, we do a call to the company to make sure that they know what those are. But with point in time ones, especially with customers, those are a little difficult to enforce. And we also want to make sure everybody's safe in all ways. But if we have a consistent issue, or if it is a store or an organization that is just not doing it, not requiring people to wear it, not being safe, we will go out. We'll have our staff go out and talk to them as well. If it becomes another factor, we will send it to the Bureau of Workers' Comp, who is doing all of the Ohio investigations for further issuance.
Great. Well, thank you so much, Jennie. And if anyone has any questions for Jennie, please put those in the chat, whether that be on Facebook or in the chat here. You can also just follow up with us and we can forward your questions over to her or follow up with her directly. But thank you again for being with us and sharing all of that information. I do want to switch gears a little bit here and talk with Dominic. You know, Dominic, you work with nurses who are out on the front lines of the pandemic, and you assist them when it comes to organizing and maintaining their union in the workplace. So I'm curious how unions like the Ohio Nurses Association have been responding to this pandemic, and how are union members relying upon their union during the pandemic?
Well, thank you for having me on here. I really am honored to be on. I think it's a very good question. There's three buckets of work that really our union members are utilizing right now during the pandemic. One is enforcing our current contract language. As John mentioned in the film, your union contract determines all of your working conditions. So if they're going to do layoffs, the order in which they do layoffs, paid time off, your access to leave, whether it's paid or unpaid. There's provisions in union contracts about, personal protective equipment, et cetera. So really holding our ground on our union contracts, making sure that answering questions from members about the union contract, and making sure that the employers are holding up their end of the bargain as far as the union contracts. So that's the first bucket that we've really been hearing from our members on. The second is health and safety concerns. So there were a lot of problems with supply shortages in reference to personal protective equipment. And so our national affiliate AFT went out and unilaterally found PPE for nurses because the situation had gotten that bad. And we were having supply chain issues and we weren't really getting a whole lot of necessarily support from Washington on that. The other portion of health and safety is OSHA complaints, which was also discussed in the film. When we have bad actors, employers that are not doing the right thing, we, help our members to file OSHA complaints and assist the investigators with those complaints. We also guide our members through the workers' compensation process if they are exposed on the job, and make sure that they have the resources they need to be able to file those claims as well. The last kind of bucket that we handle is we're communicating, the experiences of nurses to the public. We're talking with the press and getting those stories out there, how the pandemic is impacting them on the job, how the pandemic is impacting them in their homes and their families as well.
May help if I'm off mute. Yeah, that's all really good information. And I know that, with the Worker Center, most of the individuals that we're assisting are non-union, meaning they do not have a union. So many of the people who may be on this webinar really don't know a lot about unions or have never been in one, have never had a parent in one, or somebody close to them. So can you explain for those individuals, how do unions like the Ohio Nurses Association and other unions who represent other sectors of employees, how do they address health and safety issues for working people during the pandemic and then beyond it? Oh, you're on mute, Dominic. We switched back and forth.
So the one area I think that has come up in the news a lot is staffing. So nurse staffing has been an issue way before the pandemic. So we've been talking to the press and creating awareness and putting pressure on hospitals to appropriately staff. And the problem is that they've run so much of a skeleton crew for so long that the pandemic has only exacerbated the issues that were already there. When we have more nurses working, we get better patient outcomes. Those patients are better protected as well. So, raising awareness around the staffing issues and pushing that, general conversations about nurses and staffing is one way that unions are upholding that. The other is that we advocate for the nurses advocate for the patients. It helps us advocate for the public because hospitals are known locations where the pandemic is at. If we can make sure that the precautions are being taken in the hospitals, that avoids the ability for community spread out of the hospitals. So that's another way that we are upholding that. Other ways is, we're negotiating better language in our union contracts. So things like COVID leave or communicable disease leave, so that if workers are exposed, they have access to, leave paid or unpaid, that they have access to personal protective equipment. Ohio is currently not a presumptive workers' compensation state. You have to prove that you are exposed in the workplace to be able to receive workers' comp. If we can negotiate language in our contracts that make nurses that come down with communicable diseases presumptive workers' compensation, that would be, that's going to help them in the long run. And it's going to help the public as well, and helping to move things like workers' compensation. And then at the same time, when we negotiate contracts, a lot of these large hospital chains, not all of their hospitals are union. So if we can change corporate policy at one hospital, that puts pressure on the company to change their corporate policy in non-union hospitals as well. And then, lastly, by creating awareness and, raising a stink when employers are bad actors, it leverages non-union facilities to implement better standards as well. So it's, we push things on a variety of fronts within our shops and outside of the shops.
Yeah. Yeah. So, you've just touched on this concept of having a union contract, and that the contract is what's governing your terms and conditions of your employment, instead of being an at-will employee without a union who may or may not have any control over this. The employer puts forth the policies and they are what they are. With the union contract, it sounds like you get to bargain it more. You get to have more say. Your union can go in and make certain demands. The voice of the employees is more apparent, I guess, in the policies themselves, because you're having a say in them. So yes, that's all really, really good information. I guess if somebody, again, most of the people that we're working with are not union, right? And we're assisting them, they're not members of a union, but at a high level, right? And I understand that it's different every sector, and it can be very different with every union. And so we don't have to go too far into the weeds, but at a very high level, how do employees who may want to explore if they want to form a union, or if their coworkers are interested in forming a union, in order to protect themselves during, this moment during the pandemic, or, whatever, how do they go about doing so?
So there's really kind of a short-term and a long-term strategy there in my mind. You can start acting like a union by, working in solidarity with your coworkers right off the bat. Document what's going on at work. Educate yourself on your rights, as Rob Dorans has talked about. When people know about their rights, they're more likely to enforce them. You can, work with people like the Worker Center, which is a great resource to learn how to file OSHA complaints, or to call the, wage and hour line that's here in the city now, which is a great initiative that we now have. Educate yourself about workers' compensation and what that looks like. So before you even start the process of unionization, you can start to educate yourself and start to act like a union in solidarity with your coworkers. Long term, if you're looking to try to form a union, if you're interested, you should, informally and discreetly talk with your coworkers about your wages and working conditions as a first step. You can reach out to an established union, as they have the resources and the materials in place to empower and educate you through that process. Then you're going to want to meet with one of their organizers and bring, the folks that you've talked to with them, so that they can get an understanding of what's going on. And then you're going to want to build your committee, because, building a union is you're building an organization in your workplace to build democracy in the workplace, to have that say and negotiate your first contract with your wages and working conditions in it. And once you reach out with and talk with that organizer and meet as a committee, you can start the process to file for a union election under the NLRB, and get you recognition under the NLRB as well.
Great information, Dominic. Thank you for being here. You're certainly a wealth of knowledge as well. And if anyone has any questions for Dominic, please put those in the chat, whether that be on Facebook or in this webinar. We do have a couple questions, and I know that we're almost out of time here, but I did want to get to one of them. I know that one has been addressed. How long is the backlog for receiving a response to a complaint? And I saw that Jennie said we will typically not call back or respond, that the Franklin County Public Health will not typically call back or respond to the complainant that they investigated. But if the issue does remain unresolved, that they should continue to reach out to the agency. So saw that in there. But we did have a question about vaccines generally. The question specifically was, when are essential employees who work for the city able to receive COVID vaccination? But I think a lot of essential employees who may or may not work for the city might be interested in kind of understanding the vaccine rollout. So Jennie or Rob, do either one of you want to hop in and kind of address that?
So I can speak directly to the city question, that I'd love to throw it to Jennie to probably have a little bit more of a holistic view on the sort of procedure itself. So I actually texted one of our public health commissioners when I saw that question come in, because I did not know the answer to it. So luckily enough, they got back to me. So long story short, and again, Jennie can sort of talk about this process, I think, in more of a broader scale. But the way that the city is addressing this is we're following the state of Ohio prioritization groups. And those groups start with sort of first responders. It's starting with folks in long-term care facilities, frontline healthcare workers, the folks that we know have exposure on a daily basis, that we need to make sure that they are healthy, to make sure that at the basics that our public health infrastructure continues to work. One of the things when we talk about other frontline workers, whether or not those are folks that work, say, for, I know the question was about Parks and Rec employees, or say grocery store workers, or all those other kind of folks that we know that have been doing the Lord's work and keeping our society functioning over the past 9+ months. That is not a very satisfying answer to hear, hey, there's going to be a different group in front of you before the vaccines are available to you. I am incredibly frustrated about that. When you look at the federal response, we were supposed to have 20 million shots in arms by the end of the year, and we've got, hopefully we're going to get to 2 million. So I don't have a good answer for the individual is asking about those types of frontline employees, because the thing I will also say is that we tend to think about fire and healthcare workers, and again, it's important for those folks to be protected in order for things to continue to work. That said, we are trying to follow what the rules the state has laid out for us with the limited resources that we have. There's not a satisfying answer, and I wish there was. But I think it's our priority as a city to try and get shots in the arms of everyone as soon as we possibly can, because again, it's not just those workers that people think of initially. It's the people in recreation centers, people at Department of Public Utilities, at call centers. I mean, all of these folks need to get that as soon as possible. So I wish I had a more satisfying answer, but we're living in as an imperfect world as we possibly can be. But I'd love to throw it to Jennie for her thoughts.
Thanks, Robin. Actually, you said it perfectly. I couldn't have said it better. We really are sort of tied to those tiers through the state of Ohio. We're currently working through them as quickly as we can while making sure we catch up. Just one thing to note, which should still be fine, as they came out during a holiday week, we are aware that even those people who are open to may not be able to attend. So what you'll probably see within the next few weeks, or as we go forward, really are kind of tiers starting to roll together. We're not going to leave anybody behind. That's the plan, is to just make sure everybody's getting vaccinated as soon as possible. So unfortunately, I don't have a firm time frame or a timetable, nor what tier 1B will look like. That is all decided through the state level. But we are working constantly with our partners to make sure that those in those tiers know how to sign up. And once they become open, we'll make sure that information gets out as soon as we have it.
And if I can just add, I think it's really important what Jennie just said about the different tier levels that have been set by the state, is that making sure those folks that are eligible know how to access the vaccine is going to be incredibly important. And I know folks at Franklin County Public Health and folks at Columbus Public Health have been working on this day and night to make sure that when folks are able, when we have the vaccines ready to go, that there's not a delay. Because again, folks at every level of essential services need to be able to get access to this vaccine and have access to it as quickly as possible. And some of the delays we've seen at the federal level are not acceptable. And we need to make sure at the local level that we don't have those kind of delays.
Well, thank you. Good information. I know that's on the top of a lot of people's mind. So we'll keep an ear out. Again, a lot of this information is changing. It's constantly changing. Jennie, I'm sure, can tell you they've been very busy with those however many 100 something orders that, you know, they're combing through and trying to, you know, put together with pieces that were put together prior. So things are changing. And again, our videos may be outdated at some point because the law may change. So you want to keep reaching out and getting the information. And if you don't know where to go, the Worker Center is a good place to come and email and ask those questions, because if we can't tell you the answer, we'd at least probably be able to tell you who might be able to tell you the answer and get you started on the right path. So feel free to use us as a resource. But with that being said, we are past our time. So I do want to thank our panelists again, Jennie, Dominic, Rob, thank you so much for joining us today, for putting, you know, your time and energy into making sure that our community members know what's going on, know about the resources, and are up to speed as much as we possibly can. Again, this is a whole practice in and of itself. So it's a task to stay up to date. So if you are somebody that needs assistance, please reach out to us. Our panelists have made themselves available as well. So please reach out. And then we want to thank Columbus Public Health and Columbus City Council, who gave us the grant funding in order to do this project. It was quite a haul, but we were very excited to get the grant funding that we needed in order to complete this project and get the information out. The videos will be shared on our website and on our social media, and then we will be sharing this webinar as well, because there was so much additional information that we want to get out into the community. So if you want to look at that video again, it will be uploaded. It will be on our Facebook page as well, so be sure to look for that. We will have more panels coming in January. So we did a panel yesterday about unemployment, sick leave, those kinds of things, and talking about the current status. Again, that's going to change, hopefully, with more bills coming out. And that will continue to change. We're going to do some additional panels in January. We'll be talking about worker wins in the workplace and generally, some of the things that we may have already addressed, just updating people about the current status of the law. And then we'll additionally be doing a video and a webinar about high school students know your rights and the intersection of labor history and civil rights history, and how they are essentially one and the same in many, many ways. So we're going to be doing that sometime in January, and we'll have a panel all set up for that. So look for the dates coming out later on, but for now we're going to be pushing out these videos that we did this week. And then, if you're interested in the Central Ohio Worker Center, we are a community-based organization. Joining our organization is one way in which you could support us. We have committees, we get involved, we do a lot of things from policy advocacy to individual case working and working with members of the community to educating people, which is what we're doing today, just sharing the information and putting it into the hands of people that can take it and run. So that's what we do. Visit our website, visit our Twitter, our Facebook, our Instagram. We're pretty active on social media, so interact with us however you can, and we will get you the information. And if nothing else, join our listserv. You go onto our website and fill out the information, and then you'll get our emails, and you'll at least know about these kinds of webinars and things that we do going in the future. But with that being said, thank you again to our panelists, and thank you to everybody that has joined us. And if you have questions, please feel free to reach out. All right, and have a great and safe new year. Thanks, everyone.